Psychotherapeutic drugs. The types of drugs we're going to discuss: anti-anxiety, antidepressants, anti-manic, and antipsychotics. The three main emotional and mental disorders that are discussed are psychosis, affective disorders, and anxiety. Psychosis is a severe emotional disorder that impairs the mental function of the affected individual to the point that the individual cannot participate in activities of daily living. The hallmark here is a loss of contact with reality. Examples are schizophrenia and depressive and drug-induced psychoses. Affective disorders, which are sometimes called mood disorders. Changes in mood that range from mania to depression. Some patients have both, and that's called bipolar disorder. Anxiety. An unpleasant state of mind characterized by a sense of dread and fear. It can be based on actual anticipated experiences or past experiences. It may be exaggerated responses to imaginary negative situations. Okay, nursing implications. This is going to be the focus of what we're doing, is the nursing implications. Please look at the drugs that I've put on your list of the ones you need to know. Otherwise, we are looking at the major classifications here of the different drugs. So in general, what does it mean to be taking anything within the psychotherapeutic drug realm? Well, yeah, we're going to assess them for their past medical history and their past surgical history and what drugs they're on and the contraindications and all of that. We're going to assess their level of consciousness, their alertness, and their potential to injure themselves or others. We're going to encourage them to wear medication ID badges, naming the drugs that are being taken. Remember, some of these people, if they stop taking their drugs, are going to lose touch with reality, or they may be so depressed they try and kill themselves. So there need to have some kind of ID badge on them. And when we're giving the drug, we're going to check their mouth to make sure they really swallowed it and they didn't hide it under their tongue. We're going to provide simple explanations about the drug and its effects, and importantly, the length of time before the therapeutic effect can be expected. It often takes weeks before people start to feel better when taking these drugs and they think it's not working. Abrupt withdrawal should be avoided, and we should advise them that many of these drugs cause postural hypotension. That means you stand up quickly, you get dizzy. You drop your blood pressure and get dizzy. So we want to try and avoid injury here. The combination of drug therapy and psychotherapy is emphasized because patients need to learn and acquire a more effective coping skills. So drugs alone don't do it. It's drugs plus the talk therapy. Only small amounts of medications should be dispensed at a time to minimize the risk of suicide attempts. Simultaneous use of these drugs with alcohol or other central nervous system depressants can be fatal. There are many potential dangerous interactions with other drugs, over-the-counters, herbal remedies, and that includes caffeine and cigarette smoking. So thorough history is very important.